Hi, this is Carlos St. Just, licensed acupuncturist, holistic healthcare provider. Just want to speak briefly on the importance of anatomy and physiology for acupuncturists. Not specifically for acupuncturists, this video, but to inform individuals why anatomy and physiology is important and where it can come into play clinically. You might think, of course, you need to learn anatomy and physiology. Of course, that's healthcare. Duh, right? But I just want to say that, well, one, we have two different systems of medicine here. And if you've never studied traditional Chinese medicine, you will know that it is a very, well, you won't know that it is a very extensive system. And so, let me put this down. I'm covering my head. I just want to, look good, right? uh, but you can cross the two systems. Anatomy and Chinese medicine have a lot of similarities, obviously differences, but in the physiology and understanding how the body works, it really does help in order to explain to patients and other practitioners and people may not know that, hey, as acupuncturists, we are actually very well versed in anatomy and physiology. Maybe all of us have different skill levels. Me personally, it was one of my favorite subjects in school as I was studying. So, what can I say? You gravitate to what you gravitate to. And, I've always tried to, I want to get a good angle here. And I also like using the success here, like this one. Okay, yeah. And so, it comes in handy whenever I'm writing down soap notes or explaining to patients what is going on with their body. Especially in the time of misinformation, especially in the time of where people really want to know, is want to have some kind of scientific backing, and in the mainstream, that's not going to change, right? Having some type of uh, credibility to your credence. I don't know if that's the correct way to say it. I don't know. Having some credibility to whatever you're presenting. So, well, you don't know. I'm working on my speaking ability here on YouTube. It's very, very awesome in the process. In treating a patient, for instance, if someone has issues with their hand or their wrist, or the forearms, or hand wrist, let's leave it there. Usually I'll look at the muscles above. That includes the bicep brachii, or brachii, or however you want to pronounce it, or the brachioradialis, the flexor muscles of the wrist, and the extensor muscles of the wrist, extensor digitorum, extensor flexor. Geez, those are two. Okay, let's rewind that back. Uh, Flexor carpi radialis, flexor carpi ulnaris, palmaris longus. So this is from me not reviewing my anatomy. So excuse me if I have to go review my anatomy here, which I will after this video. But I just want to give an example in terms of what muscles come into your head, and what you have to know in order to treat patients, and be able to explain what's going on. And yes, I deal with chi and energy, and the meridians, and how the meridians travel. We understand anatomy in order to find acupuncture points. It's using the ASIS, for instance, to find L4, right? The anterior superior iliac spine, right? Yeah. So learning and growing, and I think we're in a time where we're all here to learn and to grow and to share our knowledge and to educate, and I'm trying to do my part here. So feel free to like the video as well if you want, and please stay safe and have some more information coming for you. Peace.